Greetings, STEM family. My name is Jennifer Taveras, the STEM Institute Administrator. I first want to thank you all for joining us tonight at our first educational info session of the spring 2023 semester in partnership with the Glaucoma Foundation, a glaucoma education pilot program for the youth. It is my absolute pleasure seeing so many students and parents interested in taking advantage of these educational opportunities with emphasis in our health. I will be operating a brief survey poll in the beginning and at the end of the presentation. We kindly ask that you please help us completing the survey polls when prompted in the screen. Candid answers only. This will help us gauge future learning objectives. Now, I have the pleasure of welcoming on stage Professor Joseph Barba, the STEM Institute Director, and his welcoming remarks. I would like to repeat the same in Spanish for my Spanish-speaking students and family members. Saludos familia de STEM. Mi nombre es Jennifer Taveras, administradora del Instituto STEM. Quiero agradecerles a todos por acompañarnos esta noche en nuestra primera sesión informativa educativa del semestre de primavera del 2023, en asociación con la Fundación Glaucoma, un programa piloto de educación sobre el glaucoma para los jóvenes. Es un placer en absoluto ver a tantos estudiantes y padres interesados en aprovechar estas oportunidades educativas, con énfasis en nuestra salud. Estaré operando una encuesta breve al principio y al final de la presentación. Le pedimos amablemente que nos ayude completando las encuestas cuando se le solicite en la pantalla. Solo respuestas sinceras. Esto nos ayudará a medir futuros objetivos de aprendizaje. Ahora tengo el placer de darle la bienvenida al escenario al profesor Joseph Barba, director del Instituto STEM, con sus palabras de bienvenida. Profesor Barba.
Thank you, Jennifer. Good evening, everyone. I want to welcome all the students and parents that are here tonight, as well as board members of the Glaucoma Foundation and other guests who are here to join us for this info session on glaucoma. My name is Joseph Barba. I'm a professor of electrical engineering at the Grove School of Engineering at City College, and I also serve as the director of the STEM Institute. The STEM Institute provides free year-round academic and extracurricular programs to middle school and high school students with the goal of helping them find pathways to higher education and potential careers in STEM. All New York City high school students and middle school students are welcome at the Institute, but we focus our recruitment on Northern Manhattan and in particular, Community Board 6. We work with schools, parents, and other organizations to accomplish our goal, and tonight, we are partnering for the first time with the Glaucoma Foundation to bring this info session on glaucoma eye disease that disproportionately impacts Latinos and Blacks. I want to thank Elena Sturman from the Glaucoma Foundation and Dr. Jose Quiroz from Mount Sinai for being here tonight. Before I ask Elena to come on stage, I want to take a minute to encourage all our students to please complete that short survey on your screen. This will help us determine if info sessions like this one are helpful to a community. Now, I have the privilege of asking Elena Sturman to say a few words and introduce tonight's speaker. Elena?
Thank you so much, Dr. Bargam. Hello, everybody. I'm so happy that so many of you could join us today to learn about vision. As you heard, my name is Elena Sturman. I am the president and CEO of the Glaucoma Foundation, also called TGF, in New York City. TGF funds glaucoma researchers and supports patients with news and education. We produce webinars and newsletters for patients and the public that feature interviews with eye care professionals and provide information about living with vision loss. If you want to learn more about what we do, you can find us on social media, including TikTok, and look us up on the web, glaucomafoundation.org. I really hope you will. I want to thank the STEM Institute at CCNY, Dr. Joe Barba, Ms. Jennifer Tavares, for helping us reach all of you today. And of course, I want to thank Dr. Jose Quiroz for making this presentation. Dr. Quiroz was born in Arizona to Mexican immigrants. Neither of his parents finished high school, but they valued learning and encouraged him to stay in school. In 2013, he earned Bachelor's of Science in Biochemistry and Molecular Biophysics from the University of Arizona. And last year, he received his MD, PhD in Biomedical Sciences from Albert Einstein College of Medicine. He is currently a postdoctoral fellow, a physician, and a research scientist at the New York Eye and Ear Infirmary of Mount Sinai, and the Glaucoma Foundation is helping to support his research this year. Dr. Quiros knows a lot about eyes and glaucoma, and as a first-generation American, he knows how hard all of you work to make your parents proud, and that sometimes they rely on you and the things that you are learning. So today we hope that you learn what you and your family need to know about protecting your eyesight. We hope you'll ask a lot of questions at the end. Now, please welcome Dr. Jose Quiros.
Thank you, Elena. Just give me 1 second to share my screen. Okay, thumbs up if you see the presentation screen. Okay. All right, so yes, I wanted to, thank you for the kind introduction, Elena. And again, my name is Dr. Jose Quiros. I am the Glaucoma Foundation Minority Fellow, and grateful for the opportunity to be here and come talk to all you here tonight. A big thank you to Dr. Joe Barba and Ms. Jennifer Tavares for helping organize this event. It's a great thing what the City of New York STEM Institute program is doing for our youth. I also wanted to thank my mentor, Dr. Avnish Diobaka, who's also here in the audience, and the New York Eye and Ear Infirmary of Mount Sinai for giving me the means and helping me get to this point to be able to talk to you here tonight. I think it's great to see so many young faces here tonight, and I know it's hard to come on a Thursday night to listen to someone you don't know listen to me, but hopefully by the end of this you'll get to know a little bit about me, and I believe that taking care of family is important, and think it's a wonderful thing what we're here to do today, to learn about a serious eye disease called glaucoma. I was also asked by the Glaucoma Foundation as this year's Minority Fellow to share with you about my journey. Like many of you guys are considering careers in the STEM field, I want to share with you, shed some light on what an MD PhD, what a physician scientist actually is. I want to start off a little bit by sharing my story. What is a physician scientist? So here we, just to get going here. So again, I will start off about my story, how I found myself to be a physician scientist, and where did it all begin? So you may ask yourself, what does a picture of Benjamin Franklin, construction tools, and the New York City skyline really have in common? But before we get to that, I want to tell you more about me. I was born and raised in Tucson, Arizona, but my parents were from a border town in Nogales, Mexico. I grew up, to say, on the poorer side of Tucson, where my father was also a construction worker, and my mother would actually sell tamales to make ends meet. I actually remember cutting the corn with her and kind of stealing some bites to help her make the tamales. Like many of you here, I was raised as an immigrant family and was the first generation to go to college, first in my family to go to medical school and graduate school. So it really hit the first in a lot of things in higher education. So going back to, what do these pictures of Benjamin Franklin construction tools in New York skyline represent? Well, when I was young, I started out really liking Benjamin Franklin, not because he was on the $100 bill, but as I read more about him, I learned he was a great speaker, a silversmith, a master of his craft, a scientist and an inventor. So these things when I was young really sparked my curiosity. And no, I didn't go out and fly a kite in the thunderstorm. Now to get to the construction tools, so the construction schools kind of lead to a story about my dad. So my dad was a construction worker. He worked with drywall. So he took me to work with him one day when I was about your guys' age, in around 8th grade. And he had me work with him starting from 4 a.m. to 4 p.m. So it was quite the ordeal. And I remember being so sore and I couldn't walk for weeks. And then my dad told me, well, you should stay in school. And he was right. That really inspired me to stay in school as long as possible, where I had the opportunity to pursue an MD PhD at Albert Einstein College of Medicine in the Bronx. But before getting to the MD PhD, I too was an 8th grader. So this is a picture of me in 8th grade. So I used to have something called like a Mexican fro. I was a pretty happy kid. I didn't really care. But as I grew up in high school, I started to take my health more seriously. I soon became the doctor of the family, but I also found myself still liking science. To my surprise, I really found out that the healthcare field actually requires a lot of math and science. So when I entered college, I was actually really interested in nursing. But because no one was around to really show me how to register for classes, being the first in my family to go to college, I ended up registering for the wrong chemistry class. I was like, oh no. What I ended up doing is I decided to keep going. But like in my first chemistry test, I didn't do so well. I actually failed. But again, not knowing too much about how college worked, I missed the deadline to drop the class. So now looking back at it, this missed deadline was really important because of this, I kept going the course. I started to go to tutoring, to go to the office hours, to the teacher. I also want to mention here, tutoring is a good thing. I remember growing up thinking tutoring meant something was bad. I didn't get it, or it was cheating, or no. I realized it was really good to help people, good to go to tutoring. You make friends, study partners. And what I realized, it was way more effective. What I would try to learn on my own in an hour, I could learn in 5 minutes by talking to someone, which freed up my time to go do more fun things like science. But to get back to my journey, I kept going and took my science classes, and I really liked biology and I liked chemistry. So much that I ended up majoring in biochemistry. I picked both, and I became pre-med at this point. Then I found out there was something called an MD PhD program that allows you to research to make medicines and also take care of people directly. So here in this picture, I did a summer internship program at Albert Einstein College of Medicine, and I loved it. Look how happy I am. I don't know what that blue stuff is, but I was pretty happy, and I liked science. And I really thought, Albert Einstein is a good place in the Bronx. I could see myself here. So I decided, I should hang out with Al a little bit longer. So this is me and Al hanging out. And then I went down, and this is my first year as a medical student at Albert Einstein through the MD PhD. Now, I will warn you, the journey is long, very long, but it is very rewarding. And also through time, it's also important through this long journey, it's also important not to lose sight of things, especially family. So here's my mom. People are always surprised actually to see how much bigger I am than her, but she's definitely a really strong woman who really taught me never to give up on my dreams. And I know the first thing I know being the first in the family to go to college, medical school or graduate school is a little scary. But also along the way, you start to realize you add to the family with your peers, like many of you will stay around you. They become your peers and start to become part of your family, and the mentors also start to become your family, kind of parents. So even though it's a little scary, you'll find your way. But sometimes you do need a little bit of emotional support. In my case, it's actually 7 pounds, furry, and also named Husky. So he's actually a Pomeranian. Also know he has his mask. He's a good dog. But I want to emphasize and remember, you don't need to wait to finish college, to go to medical school, to finish graduate school, to make a difference for your family. You can actually teach your parents about what you learned here today. And now I know you guys saw the poll going on, so I just wanted to remind you, there will be another poll as we go on later at the end of the presentation. So I want to start off with a quick video, so just bear with me as I switch over. Good.
The lovely sight of the rising sun, the high mountains with white patches of clouds floating across, the beautiful expanse of colorful flowers, the dancing leaves in the wind, the rippling waters, and cool blue skies. Nature's gift of vision gives us the enormous pleasure of enjoying such miracles. But with untreated glaucoma, the story may not be the same. Glaucoma is an eye disease with a number of different causes, which in most cases produces increased pressure within the eye. In an eye that has glaucoma, more fluid is produced than can be removed by the eye, with nowhere else to go. This fluid builds up in the eye, causing an increase in pressure. Over time, this increase in pressure transfers to the rest of the eye. The optic nerve, the weakest nerve in the eye, is most vulnerable to damage from this elevated pressure. Continuous elevated pressure or spikes in pressure can damage the optic nerve and may result in vision loss, and can also lead to blindness if left untreated. Many people don't know what glaucoma is. The exact cause of glaucoma is not known. One of the major risk factors is high pressure in the eyes. Hence, it is very important to keep up with your medicines on a daily basis to reduce the chances of gradual vision loss or blindness.
So I'm just going to switch over to our next video here.
Today's topic is, what are the types of glaucoma? 5 major types of glaucoma exist. These are open angle or chronic glaucoma. Open angle or chronic glaucoma has no signs or symptoms, except gradual vision loss. This loss may be so slow that your vision can suffer irreparable damage before any other signs become apparent. According to the National Eye Institute, or NEI, this is the most common type of glaucoma. Angle closure, or acute glaucoma. If the flow of your aqueous humor fluid is suddenly blocked, the rapid buildup of fluid may cause a severe, quick, and painful increase in pressure. Angle closure glaucoma is an emergency situation. You should call your doctor immediately if you begin experiencing symptoms such as severe pain, nausea, and blurred vision.
Okay, so that ends our video. So I'm just going to switch over back to the presentation here. Okay, so those were fun videos. We learned a lot. So now I'm going to go a little bit more into detail about these videos here. So starting off with the beginning. So what is glaucoma? So glaucoma is the silent thief of sight. So there's a reason why they call it that. So what exactly, first we've got to start off with what a healthy eye is, and then what a glaucoma eye looks like. So in the healthy eye, just like the video said, you produce this fluid and it keeps your eye's shape. But what happens if the fluid builds up because it can't be drained, then that leads to an increase in pressure, which then ultimately damages a very sensitive nerve, the optic nerve in your eye. So glaucoma is a group of eye diseases that lead to damage to the optic nerve or the retina, the back of the eye, and lead to vision loss that cannot be reversed. Very important. So who gets glaucoma? Well, everyone can get glaucoma. So worldwide, glaucoma is the leading cause of blindness that cannot be reversed. Lots of people have glaucoma, around 80 million people globally, with about 3 million patients alone in the United States. But even more so, it's the leading cause of blindness in Black Americans. And the chronic form, the open angle glaucoma, is 5 times more common among Black Americans and Mexican Americans compared to white Americans. And also importantly to mention, glaucoma can progress very quickly in Black Americans compared to white Americans as well. So what does someone with glaucoma actually see? So this is the normal vision. So you 2 happy boys with balls. I think I really like that soccer ball. So it's a nice normal vision, but then to see what if someone with glaucoma, what would they actually see? So they slowly, the silent thief of sight slowly starts stealing from the sides to create this now tunnel vision. We're not even sure if this boy has a hand anymore. We lost him. So this is it's pretty, can be very slow progressing and kind of a little bit of a scary thing. So it's very important to be aware. So what are the signs of glaucoma? So here's grandpa glaucoma. So I call him grandpa glaucoma. So you remember, the older you are, the increased risk you can get. So you remember your grandpa when you think of glaucoma. So some of the signs and symptoms of glaucoma could be waking up with headaches, so, developing cataracts, or the cloudy lens in your eye, like this white here. The white part of the eye could be red, which is not normal. You can also develop nausea, vomiting, and most importantly, you start to lose your vision and can develop eye pain. So this is the chronic form of glaucoma. But there's also something that can happen even that can be an emergency when it comes to glaucoma. So you remember the video, the second type, the acute version, can actually be an emergency. So what does that actually mean? So you can suddenly get eye pain. You can then start to see halos around lights. I know halos are typically a good thing, but not when you start to see them around the lights. So that could be a sign. Again, the red eye. So you see here the normal white part of the eye. Now you start to see this part becomes red. Then suddenly you can lead to a decrease in vision. And again, remember that this is all very sudden. All of a sudden, this starts to happen. This is an emergency, so you can kind of feel it's a little different than the more silent thief of sight, where it happens over kind of more slowly and chronic over time. Also, you see the pupil, the dark part of the eye here, there's a difference between them. So what happens in here is that normally if this was fully dilated, the entire eye would be black, but it's kind of in the middle. So you have a fixed middle dilated pupil. So again, remember, glaucoma can be an emergency. So just remember this picture to when you come to think, it's like, oh, this could be something that really could call your eye doctor. Now, speaking of eye doctors, so how is a diagnosis of glaucoma made? So you actually have to make the diagnosis by going to see your friendly eye doctor. And we're pretty friendly. We don't really scare. We come into the office. Usually it's really nice chair, and the wait's not that long, depending on the office. And you sit in this nice comfy chair where your eye doctor will shine a light, a microscope if you have, and look in the eye and actually try to see inside of it to see if there's any damage or glaucoma. And also importantly, your eye doctor can measure the eye pressure, which is one of the biggest risk factors, again, for developing glaucoma. So speaking of risk factors, so let's start off with the one that's important, really important, is high eye pressure. This is the one you have to go see your eye doctor for. You can't really feel your eye to see if there's a high pressure. So there's a reason why you should also go. We mentioned grandpa glaucoma, so being over 60, is a risk factor. But we also mentioned that being a Black American can also increase your risk. So those are over 40 are actually have already increased risk. And I know we mentioned African heritage, but also Asian heritage can also be a major risk factor, as well as having a family history, diabetes and hypertension, and being nearsighted like myself. So I can only see up close. I have these pretty thick glasses. So when you think of glaucoma as a risk factor of being nearsighted, think of me as well. So I should go see my friendly eye doctor too. So how do we treat glaucoma? Well, the answer is actually pretty simple. It's just drops. We really just, for the most part, we do drops. In some hard cases or more advanced disease, we can do other procedures or go on to do even surgery in some cases. But for the most part, your friendly eye doctor will prescribe you some drops, and then you can just pop them in, and then your vision can start to kind of come back. But this is all important, and it comes as a team. So together, we can fight the silent thief of sight and knock them out. So again, so here is the end of the poll. So I just want you guys to give you a chance to see if you've learned, if I've done a good job at teaching. So please fill out the poll, and then we'll take questions after.
Jennifer, did you put up the post survey?
Yes, I'm trying to launch it now.
Because you have the other one up still.
I ended already.
Okay.
Just give me a thumbs up when you guys want to move past the poll, and we'll open up to question and answer.
Perfect. Do you see the poll up?
I don't see the poll on my end.
No, I don't see the poll either.
Okay.
So there, you can
It's
launch.
still the baseline poll, but
Yeah, there you go.
okay.
There we go. Sorry for the delay, everyone. So if you could please just fill out that poll to see if I've done a good job in helping you learn something. And remember, the stuff you learned today, you want to go and teach your parents. You don't have to go finish college. You don't have to finish good medical school, graduate school to start making a difference for your family.
It's true. So just there's not a test. It's just simply to get a sense of whether if the presentation had some effect, and if you learned something about the glaucoma. And it's completely anonymous, so nobody will keep track of this. We're just trying to compare numbers, and that it will help us in terms of that in fact these type of presentations are helpful for our community, and I think that they are, because you normally won't see these type of presentations every day. Give it a few minutes, and then we're going to have, if you have any questions, you can ask the questions either in English or in Spanish. They just have to click submit, Jennifer, when they finish the poll. So just, when you finish the poll, just click submit and it'll come and it'll be counted that way. Otherwise we see that it hasn't been submitted.
Yes, right now we have 46% participation.
Okay. If we could get up to 50, it'd be great. So come on, students.
Come on, guys.
Let's see if we can make it. It's like
Please fill out the poll.
okay. Shall we begin, Jennifer, the questions? So if you have questions, please put your hands up. They have the electronic hands up and Jennifer will call on you.
Yes, wonderful. I have a couple questions that came in private.
Okay.
So anytime.
So.
Okay.
Okay. So what does it mean if you're a suspect of glaucoma?
So it's a really good question. So if you're a glaucoma suspect, it means that we need to watch you're being watched for the possibility of having glaucoma. So it does take some time to get that diagnosis. So you're not fully at glaucoma yet, but you're suspicious for the glaucoma.
Wonderful. Does adding a lot of makeup will cause glaucoma?
So a lot of makeup would not cause glaucoma, but it may affect your eyelashes. So keep them clean.
Okay. How many years does it take to become a doctor?
So, oh man, how many years to become a doctor? So if you want to include high school, college, medical school, and residency, it could be quite a bit. But for me, so I did high school is 4 years, college another 4 years, and then medical school itself is another 4 years. And then depending on what you specialize, could be a 3 years of training. But at that point, you've already finished your training, and you're doing more of like a hands-on kind of training, of a kind of an apprenticeship kind of training, instead of reading books. So I guess 4 years, and then depending on what you do.
Okay.
Wonderful. Also, is there an eye drop brand that you recommend?
So I have no financial disclosures, and I can't really recommend eye drops, because each eye drop actually works differently and can can help you in a different way. So there's more than one eye drop.
Wonderful. What if you do not have an eye doctor?
Well, you gotta go. You can find the New York Eye and Ear Infirmary is a full hospital just dedicated to your eyes and your ears. So you can come see us at your friendly eye doctor here.
Wonderful. Why do Black Americans get glaucoma more than others?
So that's an excellent question. So first, we don't really know what glaucoma is, but one of the things that we do know, it is affected by pressure. And one of the things about Black Americans is their corneas are actually shaped, or they're a little, the thickness of the cornea is a little different, such that it could affect the diagnosis of getting glaucoma. But to really get at why there is kind of a question up in the air, and there's more research that needs to be done. So if that's a good question. That's something that you can maybe answer as a researcher in ophthalmology.
Wonderful. You spoke about how there is a high risk for African and Asian people. What is the risk for my sister who's nearsighted and Puerto Rican?
So I don't know the percentage number, but I think it's important to just the fact that you came to the presentation today and are aware already gets you ahead of the game. So I guess I really don't know what exactly your risk is, but being aware of it is important.
Wonderful. If you were to speak with young people about glaucoma awareness, what would you say?
Can you repeat that? I missed that.
If you were to speak with young people about glaucoma awareness, what will you say?
So I guess that's what I did tonight, is to really, I would say what I said today, and I think it's really important to be aware of it, to know of it, and to have a low threshold to go see your eye doctor.
Wonderful. Does having myopia, wearing glasses and floaters make it worse?
So that's actually very good. Myopia is actually what nearsighted is. So that's exactly a risk factor. You see in floaters, that should automatically give you an indication to go see your eye doctor, especially if they're new floaters or if you see any flashes as well.
Wonderful. What is MB-PhD?
So MD stands for medical degree, PhD stands for doctorate of philosophy. So that's kind of what it is. And the physician scientist entails doing both the medicine and the science in the laboratory.
Wonderful. I have 2 more questions. When do we have to go to the doctor to check for glaucoma?
So again, so if you have any of the risk factors, automatically you should go see your friendly ophthalmologist, your eye doctor, and that's kind of the point today. And remember, grandpa glaucoma, all those signs and symptoms, and how glaucoma is a silent thief of sight. So it's you don't really notice it. So having a low threshold to go see your eye doctor is actually really important.
And the last one, can a visually impaired person become an eye doctor?
Yes, I'm visually impaired.
Okay, now I opened the forum.
There are 2 more questions. Does everybody see floaters?
Oh,
Does
those are
everybody
just-
see floaters?
So not everyone sees floaters. I see floaters, but that doesn't. It's just it's a normal thing that happens with age. But if you see a floater, lots of floaters, and it would prompt to go see your eye doctor, and your eye doctor could see the floaters, say you're okay, and then then that'll be the end of it. So floaters are kind of a sign, but also not a sign. So it's best to go see your eye doctor if you're not sure.
Okay. And the question that I have is, when you go to an eye doctor, do they normally check for glaucoma, or do you have to ask them as a special thing to check for glaucoma?
So there's actually no screening by the USPTF, the Task Force for Glaucoma. But if you have any of the risk factors that we mentioned, you automatically would get assessed. But in the normal eye exam, they would check, your optic nerve and your pressure. If your pressure and optic nerve are normal, then there's a less likelihood that you are a glaucoma, even a glaucoma suspect. A very good question.
Okay.
And there is a question for a student. My mom doesn't like me wearing her glasses and warns me every time that it can damage my eyes that way. Is there truth to that?
Oh man, I'm not sure the answer to that. Maybe Avnish, maybe do you know that?
Yeah, so sorry, I'm Dr. Avnish Talwalkar. I work with Dr. Quiroz. I wouldn't be doing that all the time. If you wear really different glasses, it can cause you to have a change because you're so young. So I mean, I'm actually wondering what it is and why you're wearing it. Maybe we need to get you to an eye doctor so you can get some good glasses. But I wouldn't do that. And if you did it once or twice, it's not going to cause any major damage, but I wouldn't do it constantly.
There you go.
And one last question, what are floaters?
So floaters, so you have this jelly in your eyes called the vitreous. And when that jelly kind of starts to loosen as you get older, you get little fragments in your eye, and those are actually what float around. But they're like I said, they're not necessarily a bad thing. Like I've had floaters for many years, and it's totally fine. But you should go see your eye doctor if you do see floaters, especially if you're of young age. So yeah.
Perfect. And those were all of the questions so far.
So we have an opportunity for anybody that wants to ask a question can also raise their hand and we called upon.
Yes, I'm going to allow the students to unmute themselves. You can raise your hand if you have further questions. Okay.
Well, all those questions that were asked were very good questions. So I'm really glad how engaged everyone was and how curious everyone is. It's really good. It really makes me happy. And I also, I wanted to also thank again Jennifer Tavares, Dr. Joseph Barba, and Alina Sturman for really putting this all together and making a really smooth operation tonight. So thank you guys.
Okay. Well, this brings an end to our info session on glaucoma. I hope the session has been very informative and makes us all aware of the dangers of this disease and that it can be treated if caught early. And I want to thank Elena Sturman from the Glaucoma Foundation and Dr. Jose Quiros from Mount Sinai for making this session possible. I also want to thank our staff, in particular Jennifer Tavares, for all the technical and logistic arrangements tonight. And lastly, to our parents and to our students, please keep in tune with us because we'll be reaching out to you with future info sessions. So thank you and good night.
Goodbye, students. Thank you so much, Dr. Quiros, Avnish, Elena, Joe, Janilda.
Thank you.
If you have any further questions, feel free to email us and we'll pass it to Dr. Quiros, who will gladly respond them at a later time. Thank you so much.